Good morning, everyone. I'm Megan Cullop, along here with Scott Micklin.
Good morning. Good morning, Megan.
Good morning, Scott.
Good to see you.
Thank you. Good to see you
Tuesday,
as well.
Tuesday, May 12th.
May 12th.
2020. And so here we go.
Yes.
Our local COVID-19 information program, produced here at KSJE. And
Live
again,
from Studio A.
Live from Studio A. Exactly. We appreciate you being here. We've got Vince Moffitt's going to call in.
Yes.
From Basin Health Companies. So we appreciate that. We've got some other information to share with folks. And so
we do.
Lots of stuff that are going on. So
lots of going-ons.
Lots of goings-ons. That's true.
Goings-ons.
Just had Jamie Church on the other show that people can find on the KSJE Facebook page or YouTube channel. She had a lot of good information about businesses, the surveys that she's been doing.
Right. They got the second survey results back, I believe.
We talked about that.
Good.
Exactly. And so folks can see that and check it out and see. But I know Jamie's been working really hard to try to get the word out that businesses in San Juan County are ready to reopen. They feel and they know they can do it safely, and the public is saying that they would be comfortable going into these businesses wearing face masks or face coverings, whatever is required, if they could be reopened and start that going. So
right.
So we'll see how that goes.
Yeah, I believe we also had some chitter chatter about that. About there's no shirt.
Chatter.
Okay. That's a thing, right?
It is now.
I'm not making
it is
that
now.
Up.
But yeah.
Right.
About the rules of a business, right?
Yes, right. So no shirt, no shoes, no service. And so somebody was positing, why not add no mask?
Right. Does the business have the right to then say? Because I think that they do, right?
They have a right to right to refuse service to anyone.
Right. That's what I thought.
Yeah, no,
if there's a sign, they can say, well, we don't have to serve, even if you are wearing a shirt and shoes.
A shirt
and a shoe.
A shoe.
That's right. That's how I go to stores.
one shoe. Do you switch which foot gets the shoe that day?
I do. They last a lot longer when you only wear one at a time.
That's true.
Yeah. See? There you go.
I like that.
Little life hack from Scott.
You're welcome, dear
right,
listeners.
everybody.
You're welcome. So
yeah.
So we'll see. And then this person said they went to a local grocery store and the store had a sign up that says do not enter this store without a face mask. I believe they even said they'll give you one if you don't have one.
Some stores are doing that, right?
So,
exactly.
Good.
So
good for our businesses out there.
We'll see. But I know a lot of folks are concerned about folks that refuse to wear a mask, even though they're asked to wear a mask in a store.
Yes, there is an element of social responsibility there.
Yeah.
I'm pro mask.
I think I am. Yeah, I am too. I don't have to think that I am. I know I am.
Yes. That's the responsible thing to do. Until
we learn more about this virus, I think it's just, there's so much unknowns that we don't know. You all right there?
Yeah,
okay.
It's only my eyes.
Sorry. At me? Hey. Okay.
I'm trying not to touch my face, but really something's cut my eye. Sorry, guys.
Okay.
Pro mask. Yes.
I will let you. Do you need to do something?
No, I'm good. I'm good.
Rub and
I
scratch.
don't know. Did something fly in? Was it the winged creatures?
I don't know. Is it the
hornets?
moth? Well, we've got moths all over the town. Holy smokes!
I would take a moth in the eye as opposed to a murder hornet.
I agree. I think that's probably a good thing. I was going to call up some numbers here real quick.
Yes.
So as we talk about what we're talking about.
Whilst you do that. I did see an article in the Daily Times this morning about, again, a lot of our local community leaders are stepping up, as well as our local community businesses, and the Rimrock Lodge, which recently has new ownership, who were trying to reinvent the place, and then the pandemic happened. Anyway, the city was working with them to establish them as a type of overflow site from the sobering center. So if somebody goes into the sobering center with flu-like symptoms,
right,
while they're awaiting their test results, they'll stay at the Rimrock Lodge and quarantine at that place. So it's good. It's helpful, I think, because, of course, the sobering center, like any other facility that houses multiple people in close quarters, is at a special risk for spread.
Right. Like we talked about yesterday with the detention facilities and things like that we've seen those things. So there's a local business stepping up to help the community. The sobering center is kind of run jointly by the city and the county and the hospital and Presbyterian Medical Services. Probably
a lot
some
of
other
people.
organizations,
Yes.
but the idea is to get folks in who maybe need help with substance abuse and those types of things and addiction problems, right? And so what you're saying is if they have someone that comes there for help, but they have symptoms, they can now put them safely, distance them away at Rimrock Lodge.
Right. So
Nice.
Yeah, so that's just a special shout out to Rimrock Lodge for that service.
Yeah. And
they
thanks
certainly
for
don't have to do that. So.
And again, a big, I think, shout out to the Daily Times for bringing that story to the public, because we wouldn't have known about it.
It's our journalistic sister or brother, depending on.
Brethren.
There you go.
Come on, you should have known that term.
Yeah, I was gonna say.
Come on. Come on. That's okay. It's all right. It's early. I understand.
Yeah.
It's okay.
And something was in my eye. I mean,
I
all
understand.
sorts of off.
It's okay.
So do we have numbers?
It's really okay. We do have numbers.
Okay.
We do. New Mexico has now topped 5,000 cases from yesterday. Again, another 207 cases. Now, let me take a look. Let me refresh that because that doesn't look right to me.
Okay.
I'm sorry, everyone. Sorry.
It's okay.
Those look like numbers from.
Oh, we did get
Other day.
a knowledgeable source that let us know that there's 361 cases on the Navajo reservation that is in our county.
That was from yesterday, right? And that
Right.
was,
So I don't know what the
believe-
updated numbers are today, but we had asked specifically in our corner of the world how many
Right.
of those cases are in our county.
Okay.
So.
No, apparently that is the updated numbers. I'm sorry. I thought, but I think that number is high, but it's accurate.
It is high.
But it's accurate. So we are above 5,000. San Juan County now 1,107 cases with 73 more. We had 8 deaths in New Mexico yesterday, but no deaths in San Juan County yesterday. And we're at 1,300 recoveries. Yesterday's numbers were notable because San Juan County now has the second largest numbers of cases in the state. We are now ahead of Bernalillo County. We had been
Right.
behind them. McKinley County still leads with the largest numbers of cases in the state. First,
then us, then
now,
Bernalillo,
then
right.
Bernalillo. We have
Which is staggering because Bernalillo is quite
much larger.
right.
And staggering because McKinley is much smaller. And
That's
they're
true.
still leading the state.
That's true.
So there's that. Scrolling down, a couple other things to note. Again, this is ksje.com, and there's more details on the cases from New Mexico. Montezuma County, again, they are up by 2 for a total of 19. The Navajo Nation, we got their numbers in yesterday. They're at 3,200, 82 new cases and 2 new deaths reported across the reservation. Of course, those are all 3 states. And for residents
Right.
of the reservation in
Right.
those 3 states. So there you go. So
Cool.
that's the numbers. That's where we are. Let's go to the phones.
Okay.
And
Right.
and see who we have. Again, we're expecting Vince Moffat to call. Good morning. You're on KSJE.
Hey, Scott. Hey, Megan. It's Vince.
Vince Moffat has called. How about that?
Yay,
See?
good.
Thank you for calling, Vince Moffat from Basin Health Companies. Appreciate your time, and we ask everybody to kind of give us an update on how your employees and your company is doing these days.
Yeah, well, we're doing okay. We've had some blows. I'm not going to lie. We unfortunately, a little bit over a week ago, we lost one of our caregivers to COVID, and it was following his son had become COVID positive due to his employment, and he passed away, and our caregiver's wife passed away right after that, and then our caregiver passed away, unfortunately, 2 days later. So, that hit us pretty hard. I'm
No
not gonna
kidding.
lie.
Sure.
Yeah. And that was there was a story on it in the Daily Times. But I think that's the reality of what we're kind of facing right now with a lot of this stuff. Now, on the bright side, we've had a lot of our patients or caregivers that have become positive and in turn have improved, which is good. That's what we want to see. So it's just one of the things we're dealing with today in our COVID age, I think.
Understood. And Vince, let me ask you, I guess maybe what that story tells us is that even though you're trying to do everything, take the precautions and be as safe as you possibly can, you still are at risk of getting infected or catching this virus or having it spread to your loved ones. Is that maybe a lesson we can take from this tragic news you shared?
Yeah, absolutely. So here's what I want to do through this death. And I mean, we've seen deaths. I'm actually on a task force assigned through the emergency manager's office to work with some of the skilled nursing facilities to help them with their infection control procedures and their use of protective equipment and stuff to make sure that it's properly in line with the CDC recommendations. A lot of people are just unaware of how a lot of this stuff is implemented because it's new to so many of our caregivers and clinicians. They've never had take such extensive steps for patients who we don't know if they're symptomatic or not symptomatic. But where it goes even further is our interactions with the public. And one of the things that's really helped us, I mean, statistically, the number of deaths that we've had and the number of cases we have had among our employees and patients has been very low. And it's true with the other home health care companies here in town. And part of that's because we can control it a little bit better. You know, we treat every one of our patient contacts as if the clinician could be carrying the virus. So we've taken steps to up the level of protection to protect our patients. So when we go out in the community, when we do things like that, we're also wearing masks. We're doing everything we can. I think our job is to, you know, in my caregiver's honor, to do everything I can to help spread the word and protect other people from dealing with the same issue. And that case where our caregiver unfortunately passed away was due to a community contact. It was a contact his son had at his job. He became positive and came home. And one of the things I think that the community needs to remember is this asymptomatic spread is, you know, 44% of the cases they're saying are asymptomatic. And so, you know, there's a lot of people that are carrying the virus that don't know they're carrying the virus and go out. And, you know, as I said, I'm going to advocate for anything I can do to improve our population, our elderly population, our medically fragile population's risk of being healthy and fighting this until we can find some sort of a vaccine or something changes in this. And so I'm going to advocate for the patients, our caregiver, and our community. And in doing that, we've had a lot of successes where we instituted a mask policy in our office. You know, we cut our footprint by about over 50%. I bet you we have 75% of our staff working remotely. But when they're in the office over a month ago, we started wearing masks, and it was our policy. Everybody had temperature checks. You had to wear a face mask in the office. So when we have had cases of COVID, like among our caregivers or clinical staff, they go home, they quarantine, and we don't have to take anybody else out of service. They don't get sick. And so there's these arguments about whether or not the mask actually reduces spread. And I know that the majority of the studies show that even the cloth-made mask reduce the spread. I mean, for a lot of people, they're talking about the size of the virus and everything and how it spread, and it can go through the mask. There's a lot of people out there that are reading things that are contrarian to the use of masks, but the majority of the data out there, what CDC is recommending, is saying that even cloth masks can help reduce the spread. So one of the things that we're preaching is the mnemonic of, or time distance shielding. So if we can reduce our time to the public, we can increase our distance from each other and increase levels of shielding, we can help keep people healthy, I think. So in our office, you know, we'll have a case here or there, just like some of the other places, but it stops with that person. And so to me, that's showing that there's some advantages of using these cloth masks and reducing the spread. And a lot of the science is coming out so quick. So one of the things that I'd say is, you know, I tell people all the time, in the end, they're going to say either we did too much or we didn't do enough. And there's no sweet spot there, right? I mean, there's not going to be we did just the right amount of stuff to protect the health and protect the economy and all that stuff. So I'm going to err on the side of I'm going to take every step I possibly can to keep these stories from happening and keep our people safe and advocate for that.
Yeah, and just a point, I had visited Basin a couple weeks ago, and you guys also have these like spray, kind of what you would spray pesticide with, filled with bleach, I believe, and you spray your shoes when you come in. So that's like an extra precaution that I haven't seen anywhere else that seems really smart. And I actually was like, I should just spray my shoes with bleach anytime I come back from the world.
Well, you're absolutely right. I mean, I've always kind of been grossed out at feet and shoes anyway, because we walk through, you know, as a firefighter, I remember going into places all the time, and then you just track that stuff with you wherever you're going. And so that practice actually came from the CDC recommendations for the skilled nursing facilities, because this virus is so it spreads so easily. Anything we can do, and shoes, you can wash your hands, and we wash our hands a lot, but who's thinking about their feet? And we're tracking this stuff around with us everywhere we go.
Right. And so do you guys currently have any patients with COVID?
We do. Most of them. So right now, I looked at the report this morning. I think we have 6 COVID positive patients. Now these are patients who are at home, and they're actually all doing pretty well. So, you know, there is some positive stories and a lot of this stuff. Remember, they still have comorbidities. They still are in the high risk category. But we have approximately 900 patients, and right now we've been able to isolate these people in their home as much as possible. And we have less than, 1% infection rate right now. We have two caregivers that are currently, one caregiver and one staff member that are currently at home on self-quarantine. They both are symptomatic. We're praying for them as well. And we're providing staff, and that's part of the thing is we're actually helping some of these skilled nursing facilities by providing staff to them that they desperately need because they have had so many staff members on rotation. So, I feel blessed because we've been able to keep it pretty low, but we're taking some pretty extensive precautions. And, Megan, I'll just add, because you made me think of something else is so important about this is everybody's saying, well, if you're sick or you're at high risk, you should stay at home. Just stay at home. And I hear that argument from a lot of people. And what I'm trying to do is advocate to the fact that these people can't all stay at home. I mean, at some point they have to go grocery shopping or someone has to go grocery shopping. Somebody has to go get something for them, and they come back to the home. And if they're infected when they're, if they're exposed to this virus when they're out in public and they're taking really extensive steps not to by wearing masks, washing their hands, but if they're exposed to it and they go back, now it's in that house. And the asymptomatic spread within the home is one of the big ones. You become positive, then you go home because you're not in the hospital. Who wants to go to the hospital if you don't have to? But now your entire family's at risk. So we're trying to limit that as much as possible. But if this thing goes on several months or longer, I feel like we need to make sure that we take steps to allow these people to still have a life at some level where they're just not trapped in their home for the next few years. And I think we can do it.
That's a good point, Vince Moffat. And I wanted to ask you, too, you talked a little bit about all the things that you are doing for your employees as they go out to help their clients and the patients and things like that. That brings up the question of, is there enough protective gear? Because I know that was an issue earlier on. Is that kind of easing? Are you able to find the things that you now need to be able to require your employees to do all this protective gearing up and everything when they go out to visit your clients?
Yeah, absolutely. I mean, I think that there's no doubt a shortage when this first started, and there still is. But we've learned things through this process of how to recondition and reuse some of the equipment. So things like N95 mask, we're able to do that in ways that improves or retains the efficiency of the mask and reduces the possibility of cross-contamination. And these have been new things that have been in the development. I've been looking and studying this based off my infection control background, and it's easily adopted, and then we can kind of use that now to be able to protect the equipment we do have. But we are seeing more equipment start to come in, and I want to give a shout out to Mike Mess, as emergency manager. He has done a tremendous job working with the state and providing equipment to us, to the other home health care companies, to skilled nursing facilities. Our traditional ways of procuring stuff through our vendors has still been a choke point for us. We still can't get hand sanitizer from those vendors. Even though we're a medical provider, we can't get N95 masks, but luckily we've been able to get them through other resources. And I think anybody that needs them, if they're in the healthcare field and they haven't been able to procure them, I think, Mike's office is a great place to start. But we feel really blessed. I mean, when we go in there, it's kind of funny because these guys look like they're going into a hazmat scene when they're going to see COVID patients. And we're doing that because we want these clinicians to be able to go back and be able to see patients tomorrow and the next day and the next day to keep their family safe and keep them safe. And once again, I think their interactions with the community and the public is so important because if the community is not taking steps to help protect not only our elderly and medically fragile, but our clinicians, then we're going to have a extreme shortage of not equipment, but people. And that's what I think the biggest shortage we're seeing around town with the hospital, skilled nursing facilities, some of these other places that I've been working with is it's a people problem right now is we're taking people out of the fight that we don't need to because they're getting sick.
Right. And speaking of PPE, I saw an interesting news article yesterday about repurposing graduation gowns. I mean, 'tis the season for graduation.
Oh, really?
Yeah. Is that something, you obviously have more of a disease background than I do, but is that something that would be helpful? Like if somebody turned in their graduation gown to you guys? We're not in that situation right now, but I think that we have been and trying to find some sort of protective
I'll tell you what, you probably look a lot more professional coming in with a graduation gown than you would a trash bag. And that's where a lot of these clinicians in these hospitals around the country were at. But, we're luckily, I think, in this area. I know the hospital for a while, they were trying to source medical gowns and things like that. So that is a good idea. And I think, it's out of the box stuff. Like right now, we're using some patient gowns that we can wash to reuse them on certain cases and things like that. So, that's definitely an out-of-the-box approach, and I think that's the one thing that we've all had to do is if you're going to do things the way we used to do it, you're probably not going to be as successful. But if you can think out of the box and come up with some of these creative solutions, we can continue to keep people healthy. As silly as it sounds, that's where we're at in this country, is that we're having to do things like that, even in our community here.
Sure. Right. Well, Vince, let me ask you, too, if you have any insights about the conditions on the reservation. Of course, we know that they are being hit hard by the numbers of cases and just some of those statistics that folks across our state are looking at, and other states, too, of the spread and how many cases we are getting over even a 2-week period. Do you see conditions there improving at all? Are they getting the equipment that they need from your contacts in the industry, or what can you share with us about that?
Well, absolutely. So an organization that I volunteer and I used to work for called Team Rubicon, they're actually out in Kayenta right now staffing one of the field medical stations, and they're seeing a lot of cases. I think one of the biggest issues they're having out there is the same issue I mentioned here in town is staffing, trying to keep people either get COVID positive or they're on quarantine and it takes them out of the fight, and so they're out for a little bit. Doctors Without Borders just showed up I think it was 2 days ago out there, and both Team Rubicon and Doctors Without Borders are working with the Indian Health Service and the Navajo Nation government to help be able to do this. Really, the answer is, though, Scott, is we've got to have more testing because if we can get more testing, obviously the numbers are going to go up. So people argue, well, if you do more testing, the numbers are going to go up, and it's not a true picture. But really what the testing does is allow us to know who needs to be quarantined and who we can keep from increasing the spread. So if people are walking around, we're not testing and they're positive, then they're just spreading the disease. So I don't understand this argument about testing, but the reservation in San Juan County, as many tests as we can do to be able to find these people who are asymptomatic and possibly increasing the spread, that we can quarantine them and get them healthy again and help slow down the spread to keep from overwhelming those poor resources out on the reservation and in San Juan County. And we're now a sub-hub here. So we were sending these people to Albuquerque and some of these other areas because they didn't have resources on the reservation to handle all the cases. And now, we're starting to receive some of those starting, probably this week, where before they were going to other areas. And it's a very complicated system, I can tell you that. And working with the Navajo Nation and state government, there's different, political aspects of things and how it works that I don't always understand, but it's not as easy as just, putting someone in a hospital. So
no, I understand.
And I'm really hoping that they continue the trends right now, and what they're doing, they're taking it very seriously out there. And we are seeing a lot of our patients live on the reservation, and I know the message is getting across to take better precautions and better steps. And, the big family gatherings that are typical with, some of our Native American culture and stuff they're doing a better job with kind of keeping those. I mean, people get it. And, unfortunately, we're seeing healthy people die, from some of these cases as well, and younger people. And those are real eye openers, for, I think, people, that are affected for sure.
Well, sure, and it hits pretty close to home, of course, and if it's a family member or a friend of a family member, and folks can certainly, see just how close to home it is hitting, and so that's what's making people hopefully stop and take notice of some of these things we're being asked to do. All of us are being asked to do. Vince, is there any other recommendations that you would have from your background? I mean, I really appreciate you being available to talk with us and share some of this information. It must make you just want to throw your computer out the window if you see posts about masks and not being effective, or some of this crazy conspiracy stuff that I really don't want to talk about on the radio, but I see it as well, and I feel bad for some of these folks that just want to share these things as just sharing information. But if you're sharing fake information, how is that helpful? I don't understand that, and maybe you don't understand it probably either.
Yeah, and I know, Scott, you and I have talked about this in the past, and this is a huge pet peeve of mine is people just sharing things because it fits their belief system without researching it. And I get it that there's a lot of unknowns, and all of us are trying to figure it out and figure out how it works. And today we're having a meeting at our office about what the new normal is. And, nothing is going to be the same as it was 2 months ago, no matter how mad I am about that and how much I want that to be the same. It's not. And so we got to figure that out. So I think that, if people are looking for answers and looking online, I would just say, hey, we do have to trust that there's people who are professionals, who are medical professionals, economic professionals, looking at this, working together, trying to come up with solutions as fast as they can. We're still learning new things, like, for example, the pediatric inflammatory multi-symptom syndrome that they're seeing now with kids that they think are related to COVID. We're going to start seeing this stuff, and so we need to tread lightly in making sure that we are doing everything we can not to spike these cases until we get stuff figured out. So I'd say I'd leave today with just saying, hey, look, the mask thing, I don't understand why it's such a big deal. Social distancing, I don't see why it's such a big deal. It's not about me. It's about my concern and my love for my fellow neighbors, my clinicians, my patients, and my parents, and those types of people. I'm going to wear a mask to show respect to them and show them I care, that I want to keep them healthy. And I think that there's enough science out there that shows that this is going to help, that it's worth implementing until we can get our minds and our science and stuff to catch up, wrap around the entire thing and see what's next.
Right.
So I would just ask people, with that stuff, is, I hate it too. I think the mask looks silly. Even though I've got some pretty cool ones now that I've been able to have some friends that I paid to make them. But I just put it on for a few minutes when I go in the store. I literally have it around my neck. I put it on. I go in the store. I do what I need to do. I come out. I hand sanitize. I take my mask off, and I'm done. And it's that easy. I don't wear it all day. It's not something that's affecting my breathing. It's not. I mean, it's just, to me, it's showing love to my community in San Juan County and to my patients, my clinicians, and those who can't and feel so helpless right now because they're so vulnerable.
Right.
I think we owe it to them. I think we owe it to that generation and that population to do everything we can to try to keep them safe and show them that they're still someone we love and we're going to care for regardless, because we told them that. We've told these people this for years, that we're going to take care of our older population and these medically fragile people. And, right now, small steps, small acts of kindness through a mask and social distancing are huge in my mind.
I agree, Vince Moffat, and I would say, too, I don't think it's necessarily just the older people, older parts of our population, but everybody. I mean, you're really trying to protect everyone, and when we don't know how this virus is going to impact everybody. Some people have mild cases, other people have not so mild cases, and there are documented stories about those, even locally, of folks who have come down with this that have had a hard time with it, and maybe not elderly, but had a hard time in recovering. And so we need to protect everybody, in my opinion. So I appreciate you being with us this morning. I know you've spent a lot of time, too, sharing some information personally and on the Basin Home Health Facebook pages and things like that. So I know you're going to continue to do that, and we'll keep in touch with you.
Yeah, and hey, Scott and Megan, I just want to leave you with one thing. I thought I had COVID starting on January 28th. I was sure of it, and it's symptomatic. It was eventually diagnosed as walking pneumonia. I got an antibody test not too long ago, and it came back negative. And I just bring that up because there's a lot of people out there that think they either had COVID or, there's a lot of things out there. And we really do not know. We do not know if we're carrying it now or if we carried it before. Until we can get tests or get antibody testing, I think we have to assume that we're all positive. We're not social distancing. So I would just ask the public to remember that. The asymptomatic spread is a real thing. COVID in Four Corners is a real thing. And let's just work together to help prevent people from getting it and open our economy back up. We can do this. It doesn't have to be all or nothing, one way or the other. We can find the spot to make this happen together, working together.
Good point. Vince Moffat, thank you so much. And we'll keep in touch with you, as I said. Thank you.
Yeah, thanks, guys. Love what you're doing, and you guys have a good week.
All right.
Thanks, you too.
You too. Thank you very much. That's Vince Moffat from Basin Health Companies.
Always a fount of information.
Definitely.
Love
Well,
it.
he's got, his background is just amazing, of all the stuff that he's done, and
Yeah.
he's,
Consistently a frontliner,
yeah,
making a life out of frontlining.
yeah, running towards these emergencies,
Yes,
not away from them.
if frontlining could be,
appreciate
that's going to be a
that.
new verb.
Is it?
I'm frontlining today.
Okay.
I think so.
Good luck with that.
So,
Yeah.
Well, so you mentioned the development of this disease and how we're constantly developing in our knowledge of this disease.
We're learning more
right?
about it. That's right.
Learning
That's
more
true.
about it as the weeks pass and perhaps even as the days pass.
Correct.
So, yeah, there was a article that came out by Dr. Mara of Harvard University's med school, and I thought this was really fascinating. So this is a direct quote. Quote, what this virus does is it starts as a viral infection, which we knew, right, and becomes a more global disturbance to the immune system and blood vessels. And what kills is exactly that. Our hypothesis is that COVID-19 begins as a respiratory virus and kills as a cardiovascular virus. That's huge, because we've been referring to it as a lower respiratory illness since it started, right? But apparently it's constantly developing, and now it's more of a global disturbance, quote unquote.
Interesting.
Yeah,
that is interesting.
It's really interesting. We're going to have to ask the doctors that, I think.
We hopefully can do that, right? We're hoping to get some Salem Regional Medical Center doctors back on the show Thursday.
Right.
So we can ask them a little bit. We do just got confirmation that Mike Mestes, the county emergency manager, is going to be with us
Great.
tomorrow.
Great.
On the show to kind of give us an update on his perspective and what's going on with OEM, so Office of Emergency Management. So that's good.
That is great.
As well. So
It's time we heard from him. We haven't heard from him since like week 1.
I know he's busy.
I know.
He's a busy guy.
Well, clearly.
I know. Not like you and I just sit around, talk to each other for an hour every day.
That's right.
But that's what we do. But that's okay. I wanted to go back to that New York Times
Yes. Yes.
data that we shared maybe a couple weeks ago, last
Yes.
week. Time is fluid,
Time
as I've
is
said.
fluid. Time is
and
always
time
fluid.
again on this program. Yes.
Time is always fluid, Scott.
Thank you.
But it's harder to keep
It's-
track of during
It seems more
quarantine.
fluid these days than before.
It's just more
I don't know.
confusing these days.
That's true.
Yeah.
But let me call that up real quick.
Great.
And if you would just give me a minute, because again, I appreciated the fact that this shows data from smaller metropolitan areas around the country, like
Yes.
Farmington. And so that's why I wanted to get
So-
back to it to see how we're doing on these things. And I believe there's a bit of maybe positive stuff here. So let me
Great.
find it here.
So while you're doing that, we
Yes.
do have it seems that our average increase day to day as far as cases across the United States is between 16 and 18,000%, which again, I want to get a statistician on here, because I don't know what 16,000% is. Like I can't,
That's a big number.
I can't
Yeah.
conceptualize it. I don't know what that means.
Big number. Big number.
Yeah.
So anyway, so here's the New York Times. This is the United States. So we can kind of see that. So it seems like the curve is flattening nationwide.
Nationwide.
Right.
Well,
as we
except
look.
that, like it said, an increase of 18,000% from yesterday.
Okay. Well, thanks,
Well, I'm
Killjoy.
just,
But yeah,
well,
okay.
that's from
All
Johns
right.
Hopkins.
I understand.
So it's not. I'm not just making it up.
I know you're not. I
Okay.
know you would never do that on this show. So
No.
that's true. But according to these graphs, it
Okay.
looks like things are starting to flatten out. Now, maybe the rates, because, again, as Vince Moffat said, the more testings we get, the more
Correct.
positive cases we are
Correct.
going to see. So,
Correct. And some places in the nation, like our corner of the world, have not peaked yet.
right.
So-
But we are getting more tests rolling out nationwide. So
Exactly.
I think we are going to see numbers probably going
Correct.
up, right,
Correct.
as we go. But if we look at Farmington specifically, right? So here we go. You can punch that into the numbers, and you can see Farmington. Our cases per day are still increasing for the most
Indeed.
part, right?
Indeed.
As we look at if we average it out, right, we're seeing the peaks and things. But our deaths are trending downward. So I'd say that's positive. But
Positive.
again, when we say Farmington, New Mexico, we're talking about the MSA, the Metropolitan Statistical Area, so that's basically San Juan County. It's not just the city limits. It's including Aztec,
Right.
Bloomfield, Kirtland, Shiprock. It's the county
Right.
that we're looking at here on these numbers. So anyway, that I thought was nice to share.
That is nice to
That
share.
our deaths
That's
are
positive.
heading down. Yes, where the outbreak is worse. So as we can see, new cases the last 2 weeks. Farmington, based on per population, right? It's still growing, and we're ranked number 6 nationwide.
It's hard to imagine.
Gallup, New Mexico is number 2. And we've talked about McKinley County.
Right.
And the problems there, the numbers of cases now leading our state. We're now second in our state. So there they are. And the new deaths, even though our deaths are decreasing, Gallup is still growing. You can see they're ranked number 1 on this graph, on the again on the right-hand side, and we're ranked at number 9, but noted as flat or decreasing.
Yes.
So that, I think, again, is something to watch.
New cases, but less death.
Correct.
So.
And as we keep going here, so growth rate of cases, again, our growth rate, Las Cruces is number 11, by the way. Farmington, we are at number 20 because our increase is smaller on new cases, which is a good thing. So these are positive things. And then the other graph on the right-hand side, the average daily growth rate of deaths, again, because our deaths are down, we're now ranked at number 90.
20 every 24.7 days.
Right. So
That is a significant improvement.
yeah. So I just thought that was worth revisiting.
It is.
Since the last time I think we looked at this graph, things were a little bit more.
We were at like 13.
Yeah, a little more scary.
Yes.
Maybe than they are right now. So,
Yes.
so I just wanted to bring that to our attention. And again, where cases are decreasing the most, we still have some work to do here. So this is places. New York City is going way down, ranked at number 4. Boston,
My old hood.
Fairfield County, Connecticut. Is that where you're looking? Okay, all right. We're still at 392.
Right.
In Farmington. But on the other side, again, where new deaths are decreasing the most, we are in the top 21, if you will. We're number 21. So that's encouraging.
That is
And I
encouraging.
hope it continues. Because we don't like
Me too.
losing any more of our
We
neighbors.
don't like death.
No, we don't. So there you are. So I just want to share that.
Thank you for that.
And I think that's a little bit more positive, at least towards the end there.
Yes.
And we could still, do what we need to do to try to bring these numbers down. As Vince Moffat was saying, if we do these physical distancing and wearing masks when we're out and about to protect others, because we may be asymptomatic and we may be infected and not know it. And
Quite possible. I agree with him that we should just assume that.
Right.
Yes.
I think that's the
because
idea.
and he's right. I have heard a lot of people even in my circles say, "Well, I was really sick in
January.
January,
Yeah, so I probably already had it.
I probably already had it." And it's like, well, that's a bold statement
Right. But,
because it could have been any other run-of-the-mill virus.
Right. But I think, again, as testing increases and we get maybe some access to antibody tests, you can find out if you actually had it.
That's right.
And then you'd know
And then you
what
know.
you're talking about.
But then we still need to ask the docs, can you get sick again?
Correct. Because, again, this is
We don't
so
know.
new.
We don't know.
There's stuff that
We don't know if
know
you can
about.
get reinfected.
Right. Well, I think there's been
We
cases
also-
of people that have been reinfected.
I think maybe. I don't know. I'd like to ask them about that.
We will ask.
Yeah. They also talked about repeated exposure. So when it comes to clinicians and such, other essential workers.
Right. Well, and again, we do know that the virus is changing. There are different strains of it, right? It's mutating. And so maybe the first iteration of the virus, you couldn't maybe get reinfected, but maybe now you can. So we'll find out.
Seems to be a possibility.
We will find out. All right. Open the phones. You want to see if anyone wants
Yeah,
to call
of
and talk
course,
to us?
of course.
Okay. We appreciate the messages. We've seen the messages, and thank you for sharing. And we're here for the community. If you would like to call in at 566-3909 and say hello, tell us what you're planning to do today, what you're doing with social distancing and wearing masks to protect others. If you may be asymptomatic, again, that is something that you could call up and share a little bit as we wrap up today's program. But again, the rest of the week, tomorrow, Mike Mestis, Office of Emergency Management, San Juan County. On Thursday, hopefully 1 or 2, maybe 3 doctors.
Hey,
From
we'll
San
take
Juan
all the
Regional.
doctors we can get.
Right. We appreciate them calling in.
We do.
And again, shout out to the community, the Sobering Center, Rimrock Lodge.
We have a follow-up on the Supreme Court story,
Oh, we do.
the toilet flushing story.
Okay.
They think it was Justice Breyer.
Justice Breyer.
I know.
Oh,
Gosh.
how disappointing.
Mute your mic, Justice Breyer. But
I
also,
don't think Justice Breyer's had good luck with technology.
well, he's
Was-
like 81 or something.
Right.
So, but he's the second oldest justice. But also, just received word from the Twitters that there was a barking dog in a Senate hearing today.
Oh. From someone else, from a stay-at-home.
Hashtag new COVID reality.
Okay.
Not every day we've heard a barking dog in the Senate chambers.
No, I don't think they were in the Senate chambers.
I
think
hope not.
they were zoomed in because there are a couple of members of the,
Yes,
of the committee that were
totally.
that were
They're
there
either
from
Zoomed
home.
or like phone,
So, yeah.
conferencing, like the Supreme
I
Court.
understand
So
that. I had a board
all
meeting.
nation leaders, mute your mics.
There you go. I had a
You had
board,
a board
meeting,
meeting?
last night via Zoom, and my dog was jumping around on the furniture in the background. I was waiting to get called
Yeah.
out, and as long as it wasn't barking, I was okay with that.
Yeah, I feel like we're all getting a little too intimate in each other's houses these days.
Right? Yeah.
I have a single chair that I take Zoom meetings from. Usually it's my office chair.
Okay.
But
Okay.
if I'm at home, it's a chair that's not, there's like nowhere near like the bedroom. I don't understand that
Right.
thing.
No.
Yeah.
Yeah, thank you for that. We appreciate
Anyway,
that. But yeah.
That's a tip for you.
But the dog
listeners.
was, he was pretty under control. He's still kind of a puppy, a little over a year old, but,
The hound.
the hound, exactly.
The Russian hound.
And he was
Boris?
Boris, the Russian hound. Yes, exactly. But he was behaving. He wasn't barking. So that's what I called that a win. That he wasn't
should.
barking.
You should. Because I also heard a horrific story that sometimes even when your mic is muted, if it's a loud enough sound, it still
Really?
goes through. They might have fixed that though.
Let's hope
now
that they
these
did.
now that these conferencing
Come on,
apps.
Zoom.
Yeah.
Get it together.
I think they're constantly reinventing themselves. They're like the Madonna of conferencing apps.
Maybe that's it. There you go. A Madge conference.
Ooh.
You're welcome. All right, everyone.
I love it.
We are going to call it a show because we
'Cause that's a
appreciate your
great note to
time.
end on.
I think it is. I think it really is. But we'll be back tomorrow. Again, you can watch us 9 a.m. live Monday through Thursday on KSJE's Facebook page and YouTube channel. You can hear a rebroadcast of the audio every day, Monday through Thursday at noon on our partner station KNMI Vertical Radio. And again, here on KSJE at 5:06 p.m. on 90.9 FM and 103.3 FM. So that's how you can hear the show and hear all this information that we are sharing with you each and every day, Monday through Thursday. So until tomorrow, stay safe and stay well, everyone. We will see you right here on KSJE. Have a good one.